Talk to me about one embryo versus two embryo, which is a very hot topic in the LGBT community.
Yes, very hot topic because a lot of people want twins for several reasons. One, people think that, oh, okay, we'll just do one transfer, we get two babies and we're done. That could be the case, but there are more complications in a twin pregnancy. We do see higher rates of miscarriages, higher rates of preterm delivery. The average gestation of delivery for twins is around 32 weeks, which most twins do okay, but they will spend some time in the neonatal intensive care unit. The surrogate is going to need most likely a C-section. Not a lot of OBs practice vaginal twin births. And then also people think that it's going to be less or it's going to be more cost effective, when in reality it's not. By having a twin pregnancy, the surrogate usually gets compensated more because it's going to be surgery. They're most likely going to have to take time off work, so they have to be paid for time off work, prolonged recovery after a C-section, and then also the complications of the pregnancy itself. Now, a lot of people also think that transferring two embryos increases the chances of a surrogate getting pregnant, and that really is not true. Pregnancy rates for transferring two versus one, pregnancy rates are the same. The only difference is that with two, you have a higher risk, higher chance of having twins. And even if you transfer two, it's not a guarantee that you're going to have twins. About 50% of those end up in twins.
So talk to me about infertility in men. I know that we talk a lot about infertility in women and what they can do, but I don't think that big part of the conversation is infertility in men.
Yeah, so we know that about 30% of all infertility in the population is due to male factor. So it is, and then 50% is usually female and combined male factor. We don't see a decline in male fertility with age as we do with women. Usually around 45 years of age, you start to see a small decline. But there are different things that a man can do to try to improve his fertility, which includes staying as healthy as possible, not being overweight, not drinking heavily, especially not smoking cigarettes or using any illicit drugs. All those things have a negative impact on male fertility. There's also a huge, I would say, not huge, but there's a big also push for men that are actually doing hormone replacement therapy with testosterone. And we know that that definitely has a huge negative impact on fertility because it lowers sperm counts and can even stop sperm production. So any man who's trying to have a child in the future should also, stay healthy, not use any testosterone supplementations, try to maintain a normal weight and a healthy lifestyle.
I'm Daniel Marzoa, a proud father, husband, and the host of the Dad Hour podcast. Having experienced the process of surrogacy, which allowed me to become a dad, I want to help others achieve their dreams too. That's why I created this podcast dedicated to the joys and challenges of the dad life. This first season will focus solely on surrogacy. I'll be joined by experts who will share valuable insights and advice for those looking to start a family through surrogacy, as well as dads who have been through the process. My hope is that in the Dad Hour podcast, fathers and intended parents find a supportive and safe space to share stories, connect, and build a community. Join me on this journey as we explore the joys and challenges of becoming a dad together. This episode of the Dad Hour podcast is brought to you by Florida Fertility Legal Services. Welcome to the Dad Hour. We have Dr. Juan Alvarez, who is an IVF doctor. Welcome to the show.
Hi, thank you. Thank you for having me.
Thank you so much for being on. Now, tell us a little bit about yourself. You're an IVF doctor. Just kind of give us an overview so the audience know who we're talking to.
Yes. So my name is Dr. Juan Alvarez. I am a fertility doctor at Kind Body. I've been out in practice now for over 7 years. And one of my biggest passions in my field is LGBTQ family building. As a gay man myself, I always find it that looking for a provider who knows who I am or where I come from is always easiest to talk to and to be able to connect with. So that's one of the passions that I started in this field.
Amazing. So when an intended parent walks into your office, what is the first thing you tell them? I'm assuming that's, when they go into the office, they've already done a little bit of research, but what would you tell them about the IVF process?
I will tell them that it does take a long time, so there needs to be a lot of patience. And so if somebody really is trying to get pregnant, I would say in the next 6 months to a year, to then start talking to a fertility doctor now, because there's a lot of different processes that have to happen that we have to discuss, like finding an egg donor, finding a surrogate, going through all the testing. So that does take a lot of time.
Yeah. And what should intended parents look for when they're looking for an IVF clinic?
So intended parents should look at websites, looking at sort of the reputation as to what are the goals or the ideas of a practice. Are they LGBTQ friendly? Do they have providers that are also part of the LGBTQ community? So those are sort of for the IPs that I talk to that are the most important.
And what are some of the challenges that you face as an IVF doctor?
The challenges is the access to care. So IVF clinics are not everywhere. Usually in major cities, we do have IVF clinics, but in rural areas, it's kind of difficult. So that's sort of where we are as a company and Kindbody. We're trying to open up different clinics here and there to be able to bridge that gap. So access to care is definitely hard. If you look at any fertility clinic right now, the wait times to see a fertility doctor could be weeks or months. There's just not that many of us as fertility specialists. It's a very small field, and the demand is very high. The other is cost. So knowing your finances, knowing how much things are going to cost, talking to your insurance company, talking to your employers about getting fertility coverage, all those things are very important.
It's all so complicated, and extremely overwhelming, and there's never really a guarantee, right, as you're going in through this process. Talk to me about that.
Yes. So for gay couples, I'm going to be speaking specifically about gay men. The chances of getting pregnant is fairly high. It's very high. So fertility is dependent on the age of the woman or the age of the egg. And many of the egg donors that we use for intended gay parents are from young women. So we know that IVF is very effective for young women. We're also transferring those embryos that are created to a woman who has been screened. We know that they have have had normal pregnancies, have not had any issues getting pregnant. So really, but we're still not at 100%. So there still can be bumps in the road. First embryo transfers may not work for whatever reason, because human reproduction really is not very efficient. And so there's a lot of inefficiencies that happen in reproduction that lowers pregnancy rates.
But when you're doing it as a gay man, you basically do everything that you can in order to increase your chances by having a young egg donor, a surrogate who has had children before. So what would you say the percentages are of a success rate when you implant an embryo?
Yeah, so there's a difference. So for gay parents, usually the first transfer is about 80% pregnancy rates.
Wow. That's high.
Very good. Yes. For an infertility couple going through IVF is closer to about 60% chance of pregnancy. So there's a big difference, and I see that in my practice, and that's how we mold our treatment options and the way that we treat a patient by their history.
Talk to me about one embryo versus two embryo, which is a very hot topic in the LGBT community. What are your thoughts on it?
Yes, very hot topic, because a lot of people want twins for several reasons. One, people think that, okay, we'll just do one transfer, we get two babies and we're done. That could be the case. But there are more complications in a twin pregnancy. Uh, we do see higher rates of miscarriages, higher rates of preterm delivery. The average gestation of delivery for twins is around 32 weeks, which most twins do okay, but they will spend some time in the neonatal intensive care unit. The surrogate is going to need most likely a C-section. Not a lot of OBs practice vaginal twin births. And then also people think that it's going to be less or it's going to be more cost effective, when in reality it's not. By having a twin pregnancy, the surrogate usually gets compensated more because it's going to be a surgery. They're most likely going to have to take time off work, so they have to be paid for time off work, prolonged recovery after a C-section, and then also the complications of the pregnancy itself. Now, a lot of people also think that transferring two embryos increases the chances of a surrogate getting pregnant. And that really is not true. Maybe it was 10, 15 years ago when our technology was not as great as doing a single embryo transfer, but pregnancy rates for transferring two versus one, pregnancy rates are the same. The only difference is that with two, you have a higher chance of having twins. And even if you transfer two, it's not a guarantee that you're going to have twins. About 50% of those end up in twins.
Really? That's still, I think, is a very high number. I remember when we went through the process, it was the doctor said you have 30% chance of both of them taking.
Mm-hmm.
But you say 50.
50. Yeah. How long ago was that?
My boys are gonna be 3. So
okay.
They were born July 2020, which is a whole other story.
Oh boy, you are in the middle of the pandemic.
I got pandemic babies that are no longer babies. So what do you tell intended parents, specifically in the LGBT community, when they want to transfer to, besides everything that you just mentioned? Is that something that you do?
Yes, I definitely do it, but I want my patients to be fully informed, not just the medical complications, but then also the legality of it and then the cost that comes with it. So before you make a decision to transfer two embryos, really understand what is that cost. And I've had some patients actually, no, I do want twins, but we know the risks. We know that it's more costly. So that actually transferred to two different surrogates to get a twin pregnancy, but not to have the risk of having a twin gestation, but two children born at the same time. So really talking to the financial people in either the surrogacy agency, knowing the true costs of a twin pregnancy, and then really figuring out what is the difference between having a singleton versus a twin pregnancy.
That's great to hear, because I feel like most doctors are like, nope, not happening. We're not doing a double embryo transfer. It doesn't matter if you're part of the LGBT community. And I've talked to a lot of intended parents who do get a lot of pushback for wanting to implant two embryos and ultimately have a smaller option of clinics that will actually do that. So it's good to know that even though it might be more expensive and there's a lot of risk, that you still do that there's still other options that you can do, have two different surrogates, and that's a safer route for everyone involved. But it's great that you do give that option.
Yeah, well, don't get me wrong, I do push back a lot, but my philosophy as a physician is that I inform my patients about every single thing. And then it's up to my patient to decide what they want to do with their family building. I mean, I can't dictate what people can or cannot do. Now, I also do within the limit of being safe and providing good care. I would never transfer 3 embryos. I would never, suggest to do anything more than 2. I really push back with 2. Most couples, after knowing, the cost and really the risks, decide not to do twin gestation. So now I've been seeing a trend, actually, even though in the populist world, like in celebrity world, or they're getting twin gestations. A lot of my patients are really considering only having one baby at a time, and then also considering the childcare and you have two children to take care for at once, and that sounds like a lot.
It is a
So
lot.
a lot of things to consider.
Definitely. That when intended parents reach out to me regarding transferring to, and they're struggling, I also tell them that it's very important that you know the risks, that you know what you're getting into, and that you do everything in order to increase your chances with the young egg donor, a proven egg donor potentially, the surrogate and all of that. But it's definitely a very important, like, you really need to know what you're getting yourself into. But I'm happy to know that you educate the intended parents to make the best decisions for them, but that a double embryo transfer can be a possibility.
Yes, it is a possibility.
So talk to me about fresh versus frozen. There's this whole conversation about that. Can you explain to me more in detail? Building a family is a dream shared by all, regardless of who you love. At Florida Fertility Legal Services, we understand the unique journey of the LGBTQ plus community. We're one of the top experienced law firms in surrogacy for same-sex couples and individuals. Our firm provides comprehensive legal support to ensure your rights and interests are always protected throughout the process. Florida Fertility Legal Services, helping you build your family with compassion, experience, and unwavering advocacy. Visit floridafertilitylegalservices.com to start your journey today.
Yes, for an egg donor, there's two types. So a frozen egg donor is a woman who's already gone through the process of the stimulation, egg extraction, and then the eggs are being stored in a place like an egg bank. And there's always advantage and disadvantages for everything. Okay. The advantage of having a frozen egg already is that they're available. You just go in, you go to the website, you pick your donor, who you like, and then those eggs get shipped to our lab, and then we get started right away. The con is that most donors make somewhere on average about, let's say, like 20 to 25 eggs, usually maybe like 15 to 25 eggs. And so in an egg bank, you're not getting all the eggs that the frozen egg donor made. So you're only getting a portion of the eggs that woman produced. And we know that not every single egg is going to fertilize, and not every single fertilized egg is going to turn to an embryo that we can actually transfer. So usually with a lot of eggs, you usually get maybe about one or maybe two embryos at most, usually only one. So for a couple who is really looking to have one child, that would be a great choice, because the cost is a lot less than using a fresh donor. So that's also one of the pros. Some of these egg banks also have a little higher price for like a guarantee. So if you don't get pregnant with the first set of eggs, they provide with another set of eggs to fertilize, grow an embryo, and then try to get pregnant. So there's also some guarantees that you can use, but really is for one pregnancy. This is what I tell everybody. Frozen eggs, really for one pregnancy. If a couple really wanted to have more than one child, then the fresh egg donor is the way to go. With the fresh donor, we stimulate her eggs, and then we get all the eggs that are harvested, and then they're either divided or not, and fertilized with the sperm with each of the intended parents. Usually, we get 2 or 3 embryos per patient, per intended parent. So, but then it's also a little bit more costly. But that really is, what are your goals? This is what I usually talk to my patients about. What are your goals? And then we set the goals to what I can provide for you.
What's the percentage of LGBT, whether couples or a single person, wanting to do a double embryo transfer?
Well, that has changed over time. Now I would say less than 20% of my couples want to do a double embryo transfer.
Really?
Yeah, it's pretty. Either I convince them really well, or we're just understanding a lot more, and there's a lot of workshops and all different talks, and I'm also part of this organization called Men Having Babies, and we have these conferences where we talk about everything and inform patients of how we do IVF now in 2023. That most people may have misconceptions or old wives' tales of you have to do this or that. And now, things change over time. So yeah, I've been seeing a lot less double embryo transfers overall as well.
That's great. So when my husband and I started the process, the first thing that we did after doing research was attend a Men Having Babies conference, and we left out of there so overwhelmed. Like our mind was spinning, it was blown. And it was like, will we ever be able to do this? Because it just seems so complicated and so expensive. What do you tell intended parents that are starting out doing their research and are like, I don't know if this is ever going to happen for me?
I would say definitely try to attend one of those conferences, because it is a lot of information, and not for somebody who wants to get started right away, just to gather information.
Yeah.
Because there is a lot of information. There's a lot of IVF clinics. There's a lot of surrogacy agencies. There's a lot of egg donor agencies. There's a lot of different legal representation. So getting the information and trying to gather all of that is great. It's a great way to start. I always say try to think of it the simplest way possible. Okay, there are three things we need in order to make a baby. You need an egg, you need a sperm, you need a uterus, right? So those are the three things that we have to work with. We need to find an egg donor, however that would be. I have also couples who either have a relative or the sister of one of the husbands is going to be the donor, or a cousin or something like that. So these are directed donors. And then that's also a different conversation that we'll have. But gathering all the information, just knowing that, try to keep it as simplistic as possible in your mind. We need an egg, we need a uterus. So then we need to go to a clinic that's going to, combine them and transfer to an embryo so that we can get pregnant. So that's the simplest way to think about it. And of course, you need legal and contracts and all these other things. But these are the things that get sprinkled in there that a full fertility clinic is going to be able to provide that whole care from start to finish.
I love that. And I think that you did make it as simple as possible for those intended parents, because it just is so complicated. But if you think about it the way you just explained it to you, it's easier to digest and understand. When we went through the process, the first time we went to Men Having Babies, and then we took that first year to interview the clinics and the agencies and find out more. I think what's important is that you know what you're looking for, right? And so we took that year, and then we went back to Men Having Babies to just make sure that that's exactly what we were looking for, and then who was the best provider for all of those different options that you should be looking for that you just mentioned. So I love that.
And I would say one more other thing about that is that you can also look at the providers that are wanting to help and work with the LGBTQ community, because not every single IVF clinic or surrogacy agency, goes to these conferences, and we are committed to helping the LGBTQ community. So really finding out who is out there helping us.
How do you find that out? How do you know whether a clinic agency is LGBT friendly?
I would start off with local clinics. A lot of patients, would like to stay in the city or place that they're at, and then looking through their websites. Do they have any sections on LGBTQ fertility, or do they have anything specific for the LGBTQ community, or family building for gay and lesbian couples on their website? Talking to the doctor, asking them about their experiences with gay couples. How many couples do they normally see? Are they part of any other organizations? And just gathering that type of information.
Why is it important to go with an LGBT friendly company?
Um, I would say because we just understand each other better. We know our own struggles. We know how we all think. My own personal primary care doctor is also a gay man, and so I feel most comfortable talking about my situation, my thoughts, my goals. There's no judgment. There's never any pushback, or there's just more of an understanding once you know that somebody else has gone through that same process.
I agree. My doctor, primary care doctor, I always look for, even a therapist, I look for a gay person because
Yeah.
you could just say one word and they understand exactly what you are talking about. And there's no need
Yes.
to explain more.
Right.
Have you had any intended parents come to you after having a bad experience at a clinic?
Yes. Oh, definitely. A lot of second opinions, a lot of, what went wrong, or what could have we done differently, or what didn't we ask, or what didn't we know what to ask. So definitely I have seen patients come from other clinics as well.
Tell me a little bit about their experience when they went through a clinic that they basically had a bad experience. Like, what are some of the red flags that they should look for when looking for an IVF clinic to just make sure that they don't have a bad experience?
Yeah, usually it comes from, and not that it's anything wrong, and there's a lot of clinics that are small and very boutique in manner, where they are very personalized, but the majority of their clientele is probably heterosexual couples. And so if you are in a smaller practice, there's no like real department that deals with surrogates and egg donors, like at Kindbody, we have our own separate team. It's called Kind EOS. We have our own separate nursing team that is all dedicated to egg donor and surrogacy. So if a clinic really doesn't have a dedicated team for that, there's, like you said, like we've been talking about, it's very complicated process. There's a lot of different steps that need to happen. And so having a dedicated team that's going to be there as a resource to help guide a patient, from start to finish, will, not that there's not going to be any bumps in the roads, because there's always going to be something that pops up, but to try to minimize any problems, or somebody who's already experienced a different problem and they know that that's going to happen to them, and they'll be able to perceive that something that they have a different kind of need. So really asking, do you have like a dedicated team that deals with surrogates, that deals with egg donors? Because you already have the burden of all the IVF patients, and then on top of that, the more complicated and more complex coordination and information gathering for a surrogate and an egg donor. So usually they come from a smaller practice where they didn't have that sort of, they felt lost, basically.
Yeah. What is the hardest part of this process, in your opinion?
Patience. Patience, because as long as you're in a clinic that like I said, I feel like most of my patients feel very, very well informed. They understand what's going to happen next. The biggest concern is that someone is getting lost in the mix, and they really don't know what's going on. And so, like I said, having a dedicated team to be able to explain things, to say, okay, now you did your semen analysis. Okay, next we got to do a sperm freeze. Next we got to find your egg donor. Now we got to do your genetic testing. So like really taking every single step at a time to try to avoid feeling that you're lost.
Talk to me about the overview of kind of like the process. You mentioned some now of the genetics and the sperm freezing. Just kind of touch on that process quickly. I know it's a long and complicated one, but just kind of walk us through what are the steps.
Yes. So the simplest steps, the intended parents come and see one of the physicians We discuss, past medical history, get to know each other a little bit more, set up goals. What are the plans for your family building? So really an initial consultation with the fertility doctor to understand, so that the fertility doctor knows exactly what the intended parent wants. After we had gathered that information, then I would do a semen analysis for both intended parents if they both want to be biological parents, just to make sure there aren't any red flags that could potentially decrease fertilization when we do create the embryo. So looking at sperm count, sperm motility, sperm morphology, and if there's some kind of abnormality, then doing a workup either with the urologist, a male urologist who deals with male fertility, an andrologist, to try to make the sperm as best before we use it. Then after the semen analysis and all that information is gathered, the intended parents need to do what's called an FDA sperm freeze. So the sperm freeze is for the sperm that we're going to actually use for fertilization. Because we're transferring an embryo to a surrogate, that falls under the FDA guidelines of tissue transplantation. So we have to make sure that the sperm is free of all of the different STIs, so HIV, hepatitis, syphilis, all those things. So the intended parents will do a full physical exam, blood testing for all of these things, and then freeze their sperm, and that's what we're going to use. During all that process, the intended parents are going to be looking through databases for either frozen or fresh donors. And at the same time, also starting the process of the matching for the surrogate, because the surrogacy usually takes the longest. Usually, matching could be, and especially now post-pandemic, could be anywhere between 12 to 18 months to find a surrogate. So we usually want to try to do the sperm freeze, find the egg donor. Egg donors usually takes about 3 to 6 months to match with, create the embryos, have the embryos frozen, so that we can then later on transfer it. The other testing that we do, all donors get genetic screening for recessive genetic disorders, which we also check for the intended parents to make sure that they match. We also discuss doing genetic testing on the embryos, how many embryos we're going to transfer, and that's pretty much from start to finish.
Phew.
It's a lot.
Thank you. Yeah, but I think that structure of how you laid it out makes it, understandable. And I'm sure that anybody that's watching this can kind of build some questions based off of, what the process, a high level process looks like of an IVF journey.
Mm-hmm.
So talk to me about infertility in men. I know that we talk a lot about infertility in women and what they can do, but I don't think that a big part of the conversation is infertility in men.
Yeah, so we know that about 30% of all infertility in the population is due to male factor. So it is, and then 50% is usually female and combined male factor. We don't see a decline in male fertility with age as we do with women. Usually around 45 years of age, you start to see a small decline. But there are different things that a man can do to try to improve his fertility, which includes, staying as healthy as possible, not being overweight, not drinking heavily, especially not smoking cigarettes, or using any illicit drugs. All those things have a negative impact on male fertility. There's also a huge, I would say not huge, but there's a big also push for men that are actually doing hormone replacement therapy with testosterone. And we know that definitely has a huge negative impact on fertility because it lowers sperm counts and can even stop sperm production. So any man who's trying to have a child in the future should also, stay healthy, not use any testosterone supplementations, and then try to maintain a normal weight and a healthy lifestyle.
Amazing. Thank you. And especially for the statistics, like those percentages I think are very important. And I think that they're eye-opening, that it's not just women who suffer from infertility, it's also men. Can you explain some of the advances within your field that that are currently happening to increase the chances of success?
Yes. So overall, just everything has improved. Our culture system has improved. We've moved from day 3 embryo transfers now to day 5 embryo transfers. We've moved to doing also pre-implantation genetic testing on embryos. That's called PGT. Because in order for anybody to be able to get pregnant, an embryo has to be chromosomally normal. That's what we know. And so if we test an embryo prior to transferring it for its genetics, for its chromosome analysis, that gives somebody the highest chance for pregnancy. Other things that have been developed, especially for male factor infertility, procedures called ICSI or ICSI, intracytoplasmic sperm injection. This is where we can choose the best sperm and then actually inject it into the egg for fertilization. There's all sorts of new treatment options for selecting sperm. There is different special washes, different special medias that we can use to, like a swim up test or the Zymot. So things to really select the best sperm in order to use that sperm for fertilization to improve fertilization rates and embryo development.
Yes, sperm, we got you covered. That's awesome.
Yes, we do.
So I know that you are a busy man and you do have to run, but what is your last and final advice to intended parents throughout this process?
I'm going to reiterate what I said. Patience is always one of the biggest things. Understand that the process is going to be fairly long. Could take maybe up to a year until you actually are pregnant. So that's why I always say start early, start gathering your information, start looking at different fertility clinics in your area. Not only in your area, like right now, since we were post-pandemic, I do a lot of virtual consults as well. And I have medical licenses in California and Illinois and Florida. So I get to see different patients, even though they're not where I am at. We can definitely do treatments in other cities if they wanted to see me. And we have fertility clinics in other states as well. So yeah, doing your research first, knowing that it's going to take time. Don't get frustrated. If you do feel very frustrated with the clinic, maybe get a second opinion. But because I really want everybody to have a smooth and a great experience, and at the end of the day, just to have a healthy pregnancy and build your family well.
Out of all the things you could do, why did you become an IVF doctor?
I think it's the most interesting field in medicine. One of the biggest drives was that there's only about 3% of fertility doctors are Latino, and probably less than that are LGBTQ. So it's a very small, specialized field that doesn't have people like ourselves.
I completely can relate, and part of why we started our family YouTube channel and even this podcast is because representation matters. And I thank you for doing the work and for being on the podcast and really helping intended parents just get a clearer vision of what the IVF process is like. So thank you for being on the Dad Hour podcast.
Oh, thank you for having me. It was my pleasure.
A special thanks to Florida Fertility Legal Services for sponsoring this episode of the Dad Hour podcast. Be sure to subscribe to the Dad Hour podcast. You can watch the interviews exclusively on the Marzoa Family YouTube channel. I'm your host, Daniel Marzoa, and for now, our hour is up. Hasta luego.